Hey everyone, I'm Risha and this is Shreya, and we are the co-founders of Wow PHM CLT, and we are so excited to have you here today for our second event.
So we will be having a dental health webinar, and we have invited two medical professionals, and February is Dental Health Awareness Month. So our first professional will be Dr. Lee, and he's a general dentist practicing in Pennsylvania. So whenever he's ready, he'll be sharing a presentation with us, and he'll go ahead and get started.
Great. Thank you for the introduction. Let's get started. Okay. Well, first of all, am I on mute? Am I good? Okay, wonderful. I want to thank the Young Leaders in Public Health and Medicine Charlotte chapter for inviting me to speak today. I think it's a fabulous thing that you guys are doing. And wherever you guys end up, whether it's medicine, dentistry, public health, it's important to have a collaborative approach to everything. And dentists, we are very appreciative to be part of the mix. And just remember that everything comes in through the mouth. All right. So we want to be part of that process, and in order to keep you healthy. All right. So I've titled this lecture "Dentistry: A Day in the Life." I think what we'll do today is we're going to start off by talking about how I got into it, what's my background a little bit, and then go into the day-to-day of dentistry, why someone would want to pursue dentistry, the pros, the cons, the nitty-gritty, and then I look forward to answering any questions that you may have. All right? So let's get started. How did I get here? All right, well, the first thing is, quite literally, you found me on Instagram, which is really cool. And I don't think that anyone in medicine or in dentistry expected to have a social media presence. But in 2021, I do feel some type of pressure to have an online presence, and not just so patients can find me, but so people can feel comfortable with me. And I think that's important. And that's how you guys found me. So I think that's actually a really cool side effect of all that. I started out my undergrad at Vanderbilt University, and I loved it there. And I know you guys are in North Carolina, a lot of you, so sorry about that. Because 2016 national champions, that was a good game. The thing that I want to highlight here is that it's actually a history major, and that might be a question that some people have going into the medical profession. What can I major in undergrad? And you'll see that I was a non-science major, which I kind of wanted to highlight. After undergrad, I went directly to dental school at Temple University, Cornbrook School of Dentistry, where I received my doctorate in dental medicine. And just something I want to point out, DMD is my degree. However, many other dentists have the DDS initials after their name. And that degree is exactly the same. You have the exact same privileges, rights, background, training, all that stuff. It's just dependent on the school that you went to, whether they're a DMD school or a DDS, but it means the exact same thing. Following dental school, I did a general practice residency at Abington Memorial Hospital, which is Jefferson Health here in Philadelphia. And that is a choice that you can make after your dental training. Sometimes you can go directly into private practice, but depending on the state, they may require you to do a residency, or you can do one because you choose to, and that's what I did. A general practice residency gives you an opportunity to be in a hospital setting most of the time, and so you're involved up close and personal with the medical community because you're part of the process for all the patients that are there. It's a really cool experience too. You get an extra year of hands-on training, and you have smaller faculty to student ratio. So you end up sort of expanding your skill set quite a bit. But then, like I said, there's a hospital aspect. So that's the most up close and personal a dentist can get, because typically the dental residents, or sometimes the oral surgery residents, are the ones on call for any facial trauma or anything like that. We get the call from the emergency room, and so we have to go in for that. So it's actually really cool. So anyone who is considering dentistry, I would highly recommend doing a residency program afterwards, whether or not it's required in your state. just because it's a really good experience and help you grow in your career leaps and bounds. Since graduating the GPR, I've been in private practice, and my father and I have a practice together in Abington, Pennsylvania. We're called Limbarakis Family Dentistry. However, I also work in New Jersey. It's pretty common after dental school to work in multiple practices, just because a lot of practices aren't equipped right away to give another dentist a full workload, so to speak, because you have to usually start to integrate yourself into the practice slowly but surely. So it's pretty common. You'll see that someone will work in multiple practices. All right, so why did I choose dentistry? And as I alluded to before, my dad is a general dentist. So I basically grew up in a dental household where I can see the profession from the other side of the chair, so to speak. The pros, the cons, the good things that come along with the dental lifestyle, and some of the challenges and frustrations too. But that's how I sort of got into the idea of dentistry. I want to be like my dad, right? So like it kind of starts with that. But as I learned more and more about it, I recognized that dentistry, it requires a unique variety of skills in order to be successful. So I was really interested in really helping people. So that's how initially I started thinking about the health sciences. And dentistry, you can't just focus on the teeth. You have to focus on the overall person and their overall health. So that was interesting to me. There's a lot of artistry to dentistry. I feel like an artist many days because I'm using my hands to create an end result. And I was very interested in art growing up. I paint and draw, and I still do. And so it was a good opportunity and a good outlet for me to use my hands. I've always felt like I've been a natural leader. And so whether it's in the community or in your office, the doctor is the leader of the practice. And so, if you're a natural born leader, it's a really good opportunity for you to resume some of those roles or assume some of those roles. If you have the entrepreneurship bug or trait within you, it's a really fantastic profession for that. Not every dental practice is privately owned, but I think it's somewhere about 80 to 85%, which are private practices. And so that's a whole different avenue in which you can flex that business muscle if you have it. And it's something that is challenging, and it's not really taught in dental school. So if you're a self-starter and you have interest in that, it's really cool. It's fun, and you can really grow in that way. I've also really enjoyed teaching, and I enjoy communicating with people. And dentistry really puts you quite literally in the mouths of people. And so you need to be an effective communicator and to be able to teach in order to make sure that your patients are healthy and that you're getting really good results. If I did not go into dentistry, I mentioned I was a history major, I wanted to teach. So it's just part of my personality. I'm interested in teaching. And so in dentistry, you have that opportunity, whether you want to teach in dental school, you want to teach in terms of teaching your assistants and your hygienists, teaching your patients about their health. So there's a lot of that. And then finally, it gives me an opportunity for constant growth. And I think that's important for anyone in any profession to have the ability to feel like they can continue to grow. Otherwise, you'll get stagnant and bored. And you'll see with dentistry, it's just fantastic. There's always something new to learn, always a new technique, technology, or material to use. So it gives me the opportunity to feel like I'm not stagnant. And I want to share this slide because this is how we sort of think of ourselves: doctor, engineer, artist. And so you're really using both sides of your brain on a day-to-day basis. And it's just fun. It's fun to be able to flex the left and the right side of the brain because you're always engaged. All right, so why should someone pursue dentistry? And there are a number of reasons, but I'm going to highlight a few things that I briefly touched on before. So if you enjoy working with people, I think that's really important because people are not easy to always work with, whether it's talking about your staff, whether it's talking with patients. you need to have a certain certain personality type to work in that capacity where it's high stress and people are relying on you to give them the best possible results. But also you need to be a good communicator. And so if you're working with people on a day-to-day basis, that's going to be something that you're going to have to really be strong at or willing to work at. If you're looking for a challenge, there is always a challenge, whether it's a business-related challenge or a clinical challenge. And I'll get into that a little bit more, but a challenge isn't necessarily a bad thing. If you're someone who's a natural problem solver or you enjoy being a problem solver, then this is a really good job for you because every day you have a challenge or 100 to solve. So it's fun and it gives you a certain boost of energy whenever you come up with a good solution for something. If you want to make an impact, if you want to help people, there's no better job than dentistry because you have instantaneous impact, whether it's taking someone out of pain or giving them a smile back or just making them feel comfortable in a setting which is normally very anxiety provoking. So if you have that ability and you want to help brighten people's day, it's great for that. I mentioned before, you need to be a strong communicator. And if that's something that comes naturally to you, this would be a really good job for that. And as I mentioned before, if you enjoy working with your hands, it's nice to be able to come up with a product, you know, whether it's a filling or a crown or doing veneers, putting an implant in. Using your hands, it engages you in your mind and your body, and it's fun, it's cool. And finally, if you're someone looking for some independence or you have that leadership trait, for whatever reason, I haven't been one over the years to want to take orders from someone else. So I guess I wouldn't be really good in the military. But being in private practice, you are your own general. And so it's actually quite interesting because you get to make decisions. You get to choose the materials you work with. You get to choose your hours. And, you know, I'll mention that my dad was always around for everything because he was the leader of his practice. He got to choose his hours and when he wanted to be there and when he didn't. Okay, so what is it not about? This is my personal opinion. Don't go into healthcare if your motivating factor is your paycheck. And given that you guys are future leaders in public health and medicine, I don't think that's what you're here for. But not that you can't make money in healthcare or that you shouldn't, but the important thing is that it shouldn't be your number one motivating factor because there are easier ways to make money if that's what you truly care about. And so if that's your number one, I would suggest maybe doing something different, maybe being involved in healthcare in another capacity. But I just think that if money is constantly on your mind, then it can cloud your judgment. And so it can be a factor, but it really shouldn't be the main one. You know, if you work really hard and you spend a lot of years sacrificing, then you deserve to be compensated for that. But just don't make sure it's not your number one thing. The other thing is it costs a lot to get into dentistry. And this is the more sobering part of the presentation. Dentistry is the most expensive graduate program. The average cost is about $400,000 after 4 years and continues to rise every year. And that's just the dental school education. Debt can range from $200,000 to $600,000 or more. And that doesn't include your undergrad. It doesn't include graduate programs if you choose to pursue them. So you need to consider the opportunity cost at becoming a dentist because for some people, it is becoming somewhat cost prohibitive, which is a sad reality, but that's kind of how things have gone in the higher ed arena. That's not to discourage you. You need to follow your passion. If you say, I don't care what it costs, this is what I want to do, then do it. But you need to be informed and you need to make well thought out decisions. So, you know, knowing that if you're going to go into dentistry, it will require hard work and sacrifice, and long hours, working weekends, working the late nights. And, but that's what you do if you're passionate about something. You find a way to make it work. One suggestion I would have is when you're choosing a dental school, tuition is a factor. And so, you know, I don't know that there are rankings for these things, but to tell the truth, I don't think that one school is $200,000 better than another dental school. And so tuition is an important factor that you need to be cognizant of. So these loans they're not monopoly money, they're real. So when you graduate, you owe the money. So make the decision that puts you in the best position at the end of the day. All right. Again, my personal opinion, you may feel otherwise. The lifestyle, not quite as cushy as it used to be. I think there's a stereotype that dentists all play golf and we only work 3 days a week and all that. And it probably was a little bit more like that in the past, but some things have changed. The involvement of dental insurance has changed things a little bit, as well as some corporatized dentistry has changed things. But just be prepared. It's not like this, I work 2 days a week and then I'm off and whatever. It does require a lot of hard work, and you have to put in your hours. Eventually, you can adapt it to your lifestyle. Once you can get rid of student loans and things like that, and work 4 days a week or something like that. But early on in your careers, you got to be prepared to work. And finally, the path to financial success is typically through practice ownership, but really it's about good decision making. So is it all worth it to me? Absolutely, 100%. There's no job I'd rather do, despite all the challenges that come along with it. And I have a lot of student loans, and it's all worth it to me because I love what I do. All right, so how does the journey start? One thing you need to do is begin with the end in mind. So every dental school has similar but not the same requirements. So you need to check your requirements early on for a variety of dental schools as a freshman or sophomore in college. Every school does require a few of the same things: Bio 1 and 2, Gen Chem 1 and 2, Orgo 1 and 2, Physics, and then also sometimes Calculus and English. These are the same, as far as when I went to school, these are the same prerequisites as if you were to go into medicine. So you can have an idea if you want to go into healthcare in general. And as you get closer, if you want to apply to medical school or dental school, you kind of have to do the same thing anyway. As I briefly touched on before, do you have to be a science major? No, I was a history major. So here's the thing, you have to look at it like this. If you're a dental school, you want to make sure that the people that you're admitting are going to be successful. And it is a dollars and cents things for them. If they admit someone that they don't think is going to be successful, and they end up having to drop out, well, that's lost tuition dollars for them. So you need to put yourself in a position where you are a really good candidate for them, where they suspect that you're going to be successful and you're going to graduate. So if you are a non-science major, take the higher ed health science classes, take the higher ed bios and physios, anatomy, biochem, genetics. Take those courses to bolster your science GPA, to bolster your science resume, so that schools don't feel concerned about admitting you. And the other thing is, don't be one-dimensional. Again, this is my personal take on it, but, and I don't know if a dental school is going to say, all right, well, this person only did their academics and they didn't have any other extracurriculars, so we're not going to let them in. I don't think that's the case. But you only have one life, and I think you should enjoy yourself. Make sure you have a social life when you're in school. Make sure you get involved in some extracurriculars, because it will make you more than one-dimensional, and it will help you relate to your patients more, and they'll want to interact with you more, because end of the day, they don't really care necessarily where you went to school. They care if they like you. And so part of that is being social, being fun, being able to converse with people, having a variety of hobbies and interests. And then the final thing you should be aware of is that in the application for dental schools, they all ask for a history of manual dexterity, which simply means, have you used your hands? How do you use your hands on a day-to-day basis? Are you an artist? Do you play any instruments? They want to know that you're not just the brain coming in, but you have hands that can function. Because while there are avenues in dentistry which you don't have to have particularly great hands, for example, if you want to do radiology, then you don't have to use your hands on a daily basis. But if you're going to be a dentist of any other kind, whether it's an orthodontist, a GP, a periodontist, or an endodontist, you got to have good hands. So they want to see that you have some type of background with manual dexterity. Okay, so what do we do on a daily basis? There is a mixture of clinical procedures, exams, problem solving, and a lot of talking. You've heard me go over that point quite a bit. There's a lot of talking, and that's important. So if you're really shy, it's not to say that you can't do it. Just be prepared that people will want to talk. It makes people feel comfortable. We're the masters of multitasking because there's always multiple things to keep your body and mind occupied. So what does that mean? So in my practice, for example, I have multiple assistants and I have multiple hygienists. So if I'm working on a patient with one assistant, I might know that I need to go do a check for one or two other hygienists, and I have another procedure going on or being prepared. So you have to be able to quickly switch gears mentally, and that's really fun for me. I actually really enjoy that. Keeps me on my toes. And I could be in the middle of a challenging root canal, for example, and then all of a sudden I have to do a hygiene check on a 6-year-old patient. And instead of thinking about a complex procedure, I'm talking about Mr. Thirsty, and I got to put on your little raincoat and all that stuff. So you have to very quickly be able to switch gears. And you may not know that you enjoy that type of thing now, but if you're going into dentistry, it's something that's a huge part of the day, unless you wanted to go into a specialty when you can really be focused on one thing. So it's really a cool aspect of the job that I have to switch gears all the time. What else did I want to go over? Okay, so the other thing about general dentistry is there's a lot of different procedures and a lot of different things to do. But if you are really interested in one area of dentistry, you can really pursue that, both as a general dentist or as a specialist. So let's just say I really enjoyed doing orthodontics. Well, then you could do as Dr. Lee did, and you can focus on that. Or you can sort of dabble in it a little bit and say, oh, I do a little bit of Invisalign because I want to mix up my procedures and I really enjoy the orthodontic process. All right. The other thing about that is you can always hand off to a specialist if you don't want to get involved in something. Something's too complex. You have a patient that maybe the juice isn't worth the squeeze because they're just a very challenging patient. We can hand them off to a specialist and they may be able to have some ability to tackle that. Like a pediatric dentist. I love seeing kids. I don't want to see every kid. It's just not for me, and I don't want to have a screaming kid in the chair. I'd rather have them go to a pediatric office where they're more equipped to handle that. So this chart represents the skills of a general dentist and all the little areas of dentistry. I don't know if these are the exact official dental specialties, but you can see ortho, periodontal, that's the gum specialists, oral surgeons, pediatric dentists, endodontists do root canals, prosthodontists and public health, dental radiology, and oral pathology. And a general dentist can choose to do all of those or omit some of those things. Like not every dentist likes to extract teeth. I really like surgery. But if you want to, you can be a part of all of this on a day-to-day basis, and it really keeps things interesting. All right, so dentistry, as you can see here, it can transform a life. This is what really got me into the idea of dentistry. These are just a few small cosmetic makeovers. These aren't anything even that elaborate, and you can see how we can change the lives of these patients. You can imagine now in an age of masks, when you really can't smile too much, it's harder to tell, but you know that someone walking around with their smile in not the best shape, missing teeth, discolored teeth, they're not going to be as confident. It's just kind of how it is. And so to give someone their smile where they can be confident, it just will change their personality. And I don't rely on the emotional feedback I get from patients, because you never know. You might do an incredible job for someone and change their life and they may not react at all. Or you might have someone cry in your chair. And it's just a cool experience. And especially the last few weeks for me, I've had some really cool aesthetic cases that I've worked on. And, you know, people have been so appreciative because they know it's not just their teeth they're fixing. It's giving them a new lease on life a lot of times. And that's something I really value. In medicine, you can certainly get a lot of this. one kind of analogy I sort of thought of when planning this was, let's just say you're a back surgeon. You know that you work on a patient, and then they still have lots of physical therapy to do down the line to make sure that they're comfortable and they're walking again, and they're feeling more comfortable. In dentistry, it's immediate result. There's no slow going process. You can fix things for someone for the better immediately. And so if you're into instant gratification, this is a really cool aspect of the job. So dentistry, as I've sort of alluded to a couple of times, blends art, science, and technology. And when I was in dental school, I really wasn't that interested in the material sciences of dentistry. What does that mean? So it means what you're using, the types of porcelains you're using, the types of filling materials, etc. Now I find it really interesting because in order to get the best results, you have to really understand the materials you're working with, their strengths and their weaknesses. So it's really cool getting to understand the material sciences and how that plays into the bigger picture. And the other thing is your canvas is your patient, right? They are living and breathing. They feel pain. They might have to go to the bathroom in the middle of a procedure. They may have a tongue that always wants to go towards your burr. They might build up saliva a lot. So, you have to be agile and be willing to work with a living, breathing canvas. And if you're interested in doing the aesthetics of dentistry and working in dentistry, but you don't want to work on a patient, you can be a dental technician and work in a laboratory. And that's great. We love working with them, and they're a huge part of our success. But it's something that you have to be cognizant of. And dentistry is rapidly evolving in terms of the technology and the materials we use. And we're doing things today on a day-to-day basis that literally we couldn't dream of 30 years ago. So I'm going to actually show a couple slides of some of the technology I use in my private practice. So this is our cone beam computerized tomography, which is a CBCT. I think this has a little sound to it. Let's hope this works. Of course, it's delaying. But basically, this is a 3D X-ray that helps you, there we go, that helps you visualize the teeth, the jaws, the nerves, the anatomy, the blood vessels, and plan your case appropriately. So it can be used in a variety of capacities. But for example, in this capacity, I'm using it to plan an implant. So I can see the bone, how much bone a patient has, the depth, the width, and where the nerves are located, so I can effectively plan my procedure from start to finish without, basically seamlessly. So it's some cool technology that we have access to. Okay, and I'll start that. This is a milling machine. We call that CAD/CAM technology, computer-aided design and milling. And so on the left-hand picture, that's me scanning one of my assistants. And we get a 3D image of their teeth, sort of like the picture you see in the middle. And then we can actually plan to mill out a restoration. For example, a crown, where if you look in the side of the screen, you see those little blocks behind the little mill. Those can be turned and transformed into crowns, which is a really cool process. So if you like playing with toys, for example, the dentistry is a great avenue for that because you have a lot of cool tech at your hands and things really change all the time. Okay, we're getting towards the end here. So one thing I wanted to mention is that dentistry, you always have an opportunity to learn and grow. You don't graduate from dental school knowing how to do every procedure or being good at every procedure. It's something you have to practice. That's what we call practice. And there's so many opportunities to expand your education, whether it's in a residency or whether it's continuing education. And I take about 300 hours of continuing education every year just to improve my skill set, to learn how to place implants. You can learn how to do Botox or aesthetics, doing digital smile designing. If you want to get better at anything, there is an opportunity for that. If you find that you've gotten bored with day-to-day drilling and filling, then that's great because you can move on and you can focus on something different. I, for example, love doing surgery. So I've started to gear my practice around surgery, bone grafting, and dental implants. And I also really love doing aesthetic cases. So I've really start to focus on that. And depending on where you practice, you can really just lean into that niche as much as you want, and that can be all you do. So I mentioned in the beginning, if you don't want to have a stagnant career, then this is a really cool profession for you. And every day brings a new challenge. And I mentioned this earlier, but challenges aren't necessarily bad things. They can be opportunities for growth. They can be opportunities to come up with a solution. So if you're someone that enjoys that, then this is a really good job for you, because if I were to sum up in one sentence, what a dentist does on a day-to-day basis, I would say solves problems. And they can be clinical or they can be patient related, right? So clinically, not every mouth is the same. There's a lot of things that can go wrong. And so there's a lot of creative solutions you can come up with. And patients, they have challenges too. They have anxieties, they have fears about coming to the dentist. You have to manage their expectations. And, but you'll find that a lot of times, the more effort you put into that, it becomes very rewarding. I've talked about this a couple of times of running a small business. Understanding the pros and cons of owning a business and how difficult it can be, but also how rewarding it can be as well. There's the time management aspect, your work-life balance, and just trying to figure out what works best for you. And like I mentioned before, you kind of have to think like a pitcher. Move on to the next pitch, which is move on to the next patient. You have a lot to do. You have a lot of people to see, so you need to be able to master your time. Online reputation. I kind of started out by saying I didn't expect that I have to be involved in Instagram and kind of highlight my career on Instagram, but it's part of the game now. And you have to learn about search engine optimization and getting patient reviews and running a blog or a website. And then managing a team. Managing people can be very challenging. That can be maybe the hardest part of the job. So there's a challenge there, but I think if you really invest in your relationships, it can be extremely rewarding as well. And then finally, staying relevant, which is, like I said, being on Instagram, staying on top of the trends, and making sure you're competitive. I think this is my last slide. Yes. Okay. So I hope I've given you some insight into the life of a general dentist, what it takes to get in, what it takes to, on a daily basis, what are some of the challenges, and what are some of the amazing things. And for me, it is incredibly gratifying. There's no other job I'd rather do. So one thing I kindly request is you guys found me through Instagram. So I'd love if you all gave me a follow. I post some really cool content. I'm doing some interviews. I do some before and afters, and I do a lot of a series called Let's Talk About, which is basically teaching about the mouth and all the other things that go along with it. If you reach out to me, I absolutely will get back to you. I'm unfortunately always on my phone, so I will respond, and I'm glad to help and answer any questions you have, mentor you in any way. I promise this is something that I'll be invested in you if you're interested in having me help you. So that's all I got for you guys. And I guess we can kind of go from here.
Okay, awesome. Thank you so much, Dr. Limberakis. That was a very informative presentation. So if any of you have any questions, you can let us know in the chat. And also, we'll be taking a quick picture. So if you guys could just turn on your cameras just for a quick picture, and you can turn them back off if you want. And then we'll be having a quick break, and afterwards, Dr. Lee will be going on.
All right, I got to figure out how to get back to this whole screen here. I don't think I've done a Zoom with more than 5 people. There we go. Am I still on share screen?
Mm-hmm. Yeah, you are.
Okay.
Okay, awesome.
All right.
You can go ahead and take the picture.
Okay, I'll count down, and then everybody can just smile. Okay. 3, 2, 1. All right.
Awesome. Thank you, guys. So it's 3:35 right now, so we'll have a short break until 3:40, and then we'll have Dr. Lee go on.
Thanks, everyone.
Thank you
Thank
again.
you.
How's it going?
Hey, I caught the tail end of your presentation. It was great.
Thanks. It was weird being able to talk for that long and
Yeah.
not get any response or feedback. So it was a little weird.
Zoom is definitely a weird thing, but becoming the norm.
Yeah. So you just finished your residency, huh?
I did. I graduated last Friday, actually.
Congrats.
Thanks. Took my second board exam, or like part 2 of boards, yesterday, actually. So it's been a crazy week, but I'm kind of glad that it's all over now.
Yeah. That's awesome. Where are you going to be practicing? Do you know yet?
Yeah, so I'm actually starting my associateship in April. I'm staying in Colorado, so it'll be around the Denver area.
Cool.
Yeah.
A lot of opportunity there.
Yeah, it's definitely getting pretty competitive here. Looking for jobs in Colorado is pretty tough, but I mean, I guess it's kind of true wherever you go these days, but.
Yeah, pretty much.
Yeah.
So
Where are you located again?
I'm outside Philly.
Okay.
Yeah.
Yeah. Cool.
Did any of my content kind of overlap with what you have planned, or?
A little bit, but not too much. I think you definitely went into a lot more detail than I prepared, so I'll have to do a lot more talking. But no, it looked great.
Yeah, it was. I wasn't sure like quite the audience, so it was. I think given who we're gearing this towards, I think I got it right, but I'm not totally sure.
Yeah,
I guess I'll find out.
Yeah, no, and I think it's good that they can always reach out to us too and ask us questions if they need.
Yeah, definitely.
Yeah.
That's awesome.
Well, it's good to meet you.
You too. I'm actually going to hang out and watch your presentation.
Oh, yeah, awesome.
Yeah.
That's great.
Yeah. All right, well, I'm going to just go mute myself here. So
Okay.
I'll see you in 3 minutes.
Sounds good.
All right.
Try to share my screen.
Okay, guys, so it's 3:40, so we'll go ahead and start back. So next we have Dr. Lee, and she's an orthodontist currently in Colorado, and she actually just graduated from CU Boulder last month. So thank you for joining us, Dr. Lee, and whenever you're ready, you can go ahead and begin.
Sounds good. Hello, everybody. Thanks so much for letting me join today and talk to you guys a little bit more about what I do and a little bit about orthodontics. I know Dr. Limbarakis talked a lot about general dentistry and getting through dental school, and he was very thorough. So I'm going to kind of breeze through that part and kind of share a little bit more about what an orthodontist does. So let's get started. So a little bit of a background about me. I'm originally from Nashville, Tennessee. I was born and raised there, lived there until I was graduated from college, actually. I'm actually the first dentist or doctor in my family. My dad actually wanted me to become an accountant, but it's definitely not something I was interested in. So I chose to go to dental school, and I've been loving it so far. Like they mentioned, I graduated from residency actually last week from University of Colorado. So I'm actually still in Colorado. My husband and I recently bought a home here in Highlands Ranch. It's about 30 minutes outside of Denver. And I live here with my husband and my pup Louie. He's joining us right now. All right, so education. Let me minimize this. So like I mentioned, I was born and raised in Nashville. I went to college in Nashville at a college called Vanderbilt University. I received my Bachelor of Arts in Cellular and Molecular Biology back in 2013. I then went to a master's program at Boston University, and I can talk a little bit more about this if you guys have any questions, but kind of wanted a year to boost my resume and credentials and kind of get a better chance at getting into dental school. So I applied to a master's program at Boston University. It was a master's program for oral health sciences. And it was a one-year program. You could choose to do 1 or 2 years, but I was able to get into dental school after 1 year. So I graduated from that program in 2014 and went straight into dental school at Boston University and graduated there with my DMD in 2018. And then through dental school, I became really interested in ortho. I actually always had an interest in ortho. I had ortho as a kid myself, had braces for about 4 years total. So it had a big impact in my own life, and I chose to pursue orthodontics as a career. So I applied and I chose to come to University of Colorado. Ortho residency is usually between 2 to 3 years. Ours was a 2.5-year program. So I started right after dental school in 2018 and just finished last week. So I got my MSD and certificate in orthodontics last week. As far as career, I obviously just graduated, so I haven't begun a job quite yet, but I did receive an offer, and I'll be starting my first associateship next month in April. So it's at actually a corporate office, and they want me to kind of travel around 4 locations. It's pretty common for specialists to have either like multiple part-time gigs or a full-time that you might be traveling between offices, just because unlike general dentistry, you're only seeing patients, every 4 to 6 weeks or 4 to 8 weeks. So the scheduling of seeing patients is a little bit different. So I'm excited to start my career finally, start paying off my loans and just getting in the real world. Eventually, I would like to open up my own practice, but I did want to get some experience first and kind of hone in on my orthodontic clinical skills before I dove into the business part of it. So that is in my future career plan, is to open up my own practice. All right, so why did I choose to pursue dentistry? I actually, when I was in college, I wanted to do something in the healthcare profession. I considered med school, pharmacy school, and I actually had a family friend who was studying for the DAT at the time. So she kind of introduced me to the idea of dentistry and kind of advised me to try shadowing and see if I like it. So I started shadowing a few different dentists, and there were a lot of attractive aspects of dentistry that I felt medical school or, practicing in a hospital didn't really give you, and that was being able to connect with your patients a little bit more. You see these patients pretty regularly, and you establish a relationship with them. So I really enjoyed that aspect. I really also love that it's a very artistic career. You use a lot of manual dexterity, and you kind of have to be aware of a lot of different details and creativity. So it was kind of a mix of, a logical aspect of being a healthcare profession, but also kind of utilizing your creative side and making a beautiful smile and making sure everything is very aesthetic. Another aspect of dentistry is that you're able to own your own practice and run your own business, which is pretty unique to the healthcare profession, I think, rather than being employed in a hospital. Obviously, there are, doctors and specialties of medicine where you are able to own your own practice, but dentistry is one of those, and you're able to be both a dentist and a business owner. So I really like that aspect as well. More specifically, why did I choose to pursue orthodontics? So, like I said, I had braces as a child. I had a phase 1 for 2 years, and then a phase 2 or comprehensive treatment for 2 years. So I had 4 years of braces, and it was a long 4 years, but it definitely made a huge impact in my life. Having a beautiful straight smile has a huge impact on your self-esteem and your confidence. And I'm still grateful to my orthodontist today for, giving me the teeth that I have and the smile that I have. So it was kind of always in the back of my mind that ortho was a field that I was interested in. Obviously, I didn't know too much about it until I got to dental school and I was starting to look at all the different specialties. First of all, orthodontics is a very rewarding profession. Like I mentioned, you are impacting your patients in such a positive way. I think one of my favorite moments of being an orthodontic resident was debond day, when we would take off our patients' braces, and we don't let them look in the mirror until all the polishing's done, all the edges are smoothed out, and that look in the mirror when they finally get to see and they're so excited and happy and they're able to kind of feel how smooth their teeth are. It's a really fun and rewarding experience both for the patient and the orthodontist. So that's still forever one of my favorite parts of orthodontics and favorite parts of treating my patients. Relatively, it's a stress-free career. Obviously, with any profession, any healthcare profession, you are going to deal with certain stresses. But I feel overall orthodontics is a very positive career, in that a lot of the patients that you see want to be there and want to see you because they're coming to you to get straight teeth. And so it's a lot of positive vibes. Obviously, here and there you get some kids that don't want to be there, but overall, patients are happy to see you. They're not in pain or anything like that. So it's a very, refreshing experience, I guess. Like I mentioned with dental school, orthodontics is also something that utilizes both logic and creativity. So I guess you get to utilize both your left and right sides of your brain. There's a lot of physics involved, a lot of biomechanics and mathematics, and being very logical about things when you treatment plan. But there's a very artistic side to it too. Every face is different. Everyone's teeth are different, the shapes and sizes of them. So you have to utilize your creativity and kind of be artistic when you're creating a smile tailored to your patient. I also love that every case is a new puzzle. Like I mentioned, not every face is the same. Not every set of teeth are the same. So obviously you kind of get into groove of things when you start practicing and you see patterns, but not every case is going to be the exact same way you treat something. So anytime you see a new case you have to treatment plan, it's always kind of a fun puzzle that you have to solve and be creative about how you're going to tailor their treatment. Another aspect of orthodontics is obviously a long-term treatment. So you develop a relationship with your patients over the 1 or 2 years that you're treating them. I especially love treating my adolescent and teenage patients. They're so much fun to talk to, and just talking about the things that they're going through in life at that time is really special. And I've really enjoyed being able to kind of become a mentor to those patients. This is actually one of my patients that I treated in residency. She was one of my favorite patients, so sweet. And on the last day that I was delivering her retainers, she actually told me she wanted to pursue dentistry, and she was really excited about it and asked me for my email address and number to see if she could get advice from me. So that was probably one of the most rewarding things I've experienced in residency, and kind of reminded me why I love what I do. And then, like I mentioned, orthodontics, you see a lot of adolescents and teenage patients, but you also treat a good number of adults. I think more and more adults these days are becoming interested in orthodontics, especially clear aligner therapy, such as Invisalign. So you get a wide range of ages and different types of patients that you get to see. So aside from just getting straight teeth and making a pretty smile, there's actually a lot of things that are important about the field of orthodontics. First and foremost, it has such a huge impact on a person's self-esteem, confidence, especially for young kids who may have, really protruded or preclined teeth, really big teeth for their face, and it could have a big impact on their psychosocial aspects and their confidence in that way. So that's actually one big reason we treat a lot of kids and adults, is just being able to give them the confidence they need to even just go about their day. And it really transforms a person, and it's really exciting to see that through the progress of treatment. Another reason is that straight teeth actually benefit your dental and periodontal health. Periodontal health meaning the health of your gums. So when you have really crooked teeth or spaces in between your teeth, or teeth that aren't aligned, it can actually impact food getting trapped. You're not able to clean as well, and it can actually cause a negative impact on your gums and your periodontal health. So it's another reason you might think about getting braces. Another thing is that a lot of patients actually come to us with TMJ pain. TMJ is it's the temporomandibular joint. It's actually your jaw joint. And a lot of patients come because they have a lot of pain there, a lot of inflammation, and we are able to actually treat these patients with a splint and kind of find a more stable and comfortable bite for them. We start off with a splint, we find where the jaw is most comfortable, and then we'll go ahead and go through with braces to fix the teeth to that position. Another reason is a lot of kids start to develop jaw discrepancies when they're young, or different skeletal issues. So orthodontics is not just about straightening teeth. We actually look at your whole face and the skeleton behind your face. Some people have really small jaws, or really small mandibles, or your lower jaw, or really small maxilla, which is your upper jaw. And when we catch that at an early time, and at a time we're able to utilize growth, it's actually really beneficial, because we can use certain appliances to help promote the growth of your jaws to make them more balanced. If they come to us when it's a little bit too late, meaning if they've already passed their growth spurt and the jaws have kind of finished developing and growing, and there's not much we can do orthopedically, an option would be to set them up for orthodontic surgery. So we actually work very closely with oral surgeons who actually do the surgeries of the jaws. Will line the teeth up, send them for surgery. The surgeons will actually fix the jaws to where they should be, send them back, and then we'll kind of finish up the treatment with braces and get them a nice smile. I have an example of a case that I can show you later on. Another thing is phase 1 treatment. Like I mentioned, I had phase 1 treatment as a kid, and there's specific goals that we tried to achieve during phase 1 treatment. One example is if their top jaw is too narrow and we want to widen it to, fit with the lower jaw. Your top teeth should fit over your bottom teeth, kind of like a shoebox lid on a shoebox. It should kind of fit right over your bottom teeth very nicely. If it's not fitting, it can actually cause the patient to shift their bite. And if they shift their bite for long enough, it can actually affect their growth. And it can negatively affect growth and cause, once again, the jaws to develop in a mismatched way. So it's really important to catch these problems early on. A lot of kids come to us with thumb sucking habits or tongue habits that will also cause the teeth to shift and develop in the wrong way. So we like to catch these early as well. We have a lot of different appliances we can use. We have tongue cribs. We actually can put a little cast on the patient's thumb to help prevent them from sucking their thumb. These are things that pediatric dentists can do as well, but a lot of pediatric dentistry and orthodontics overlaps just because we do see a lot of the same age group and pool of patients. So these are some reasons why orthodontics is important other than just straightening teeth. So here's a little fun phase 1 case. Like I mentioned, a lot of phase 1 cases we see are expanding the upper arch or the maxilla. You can see here that the patient has an underbite, both in the front and in the back. She has a posterior crossbite as well. And this is a result of her upper jaw just not being wide enough, fitting correctly with the lower jaw. This patient also had a shift, meaning she wasn't actually biting in an underbite where her jaw should have been comfortable, but because it was uncomfortable for her teeth to kind of bite on top of each other, she was continually shifting her jaw forward. And like I mentioned, if you keep doing this for long enough when you're younger, it can actually cause a permanent change to your jaws and your skeletal structures. So we like to catch these types of malocclusions early. So we treated this patient just on the upper arch. Phase 1 treatments are supposed to be short, quick, simple. We're just trying to address the main problems. If we want to straighten the front 4 teeth, we can, but the main priorities of phase 1 are to help, develop enough good foundations for them to develop a good bite. And if later on they want to get phase 2 because they still feel like their teeth are crooked or, they develop other things in that meantime, we'll address those in phase 2 treatment. So for this patient, it was a quick phase 1. We did an expander here. We call this an RPE or rapid palatal expander. And the more technical term for this specific expander is a Hyrax. So we cemented this Hyrax and we also bonded 6 brackets with bands on the back. And we wanted to kind of expand, I don't know if you can see, but expand the upper arch and also bring these front 4 teeth forward a little bit just to help prevent any underbites from happening again. And this was how she finished. Like I mentioned, there's still things that we want to address eventually, probably down the line, but we wanted it to be a short phase 1. We got enough expansion where she's no longer in crossbite in the front and the back. We've closed that space here. I don't know if you can see here, she has a really cute little peg lateral. And that just means that her lateral is a very small, abnormally shaped tooth. And so another reason why she's probably going to need phase 2 is when she's older and she has all her permanent teeth in, we're going to want to, have a referral to a general dentist that we can work with in order to make enough space for them to either build up this tooth or do a veneer or something like that to make it a little bit more of a normal size and shape. This was a very simple Invisalign case. The patient came in because she didn't like this open bite she had in the front, and obviously she had some crowding here. At first glance, this may seem like a pretty simple thing to fix, but these small laterals are actually pretty tough to grab onto with Invisalign. So we did have to do a few refinements to kind of get them exactly where we wanted them. So this was the first, I guess I didn't put the refinement in here, but we did a few refinements where we had to continue to make adjustments on the ClinCheck software, and I think the total treatment time was about a year and a half. But obviously in the real world too, things move a little bit more quickly than residency. Since you're still a resident and you're learning, things do tend to take a little bit longer. But overall, the patient was really happy with her results. She no longer had those windows in the front. All the crowding has been resolved. She's got a really nice, broad, bright smile. This patient came to us because she didn't like this lateral open bite she had. You can see here that she kind of has like a tongue habit, a habit of posturing her tongue forward there to fill that space. So a really important thing in a case like this is to make sure you train the tongue first to position correctly so that this doesn't happen again in the future. If you look over here in this x-ray, we call this a lateral ceph. It's basically an x-ray of this side of your face. So you get a lot of information from just this snapshot. You can kind of assess how much growth they have left, looking at the cervical vertebrae and the curvature of each vertebra. You can look at their skeletal pattern. You can look at how long their jaw is, if their growth happens to be more vertical or more horizontal, which can impact your treatment. You can also look at how proclined or protruded your teeth are, meaning how flared they are or how up, in the front they are compared to where they normally should be. So a lot of things we can look at this ceph, and this is one of the main diagnostic tools that we use as orthodontists. Here you can see she does have quite a bit of flaring in those upper and lower incisors. And if we were to try to fix her bite without taking out any teeth, it would actually probably flare them out even more, which would have detrimental effects to her gums, could cause a lot of recession, and overall periodontal health would be compromised down the line. So we decided to treat this patient by taking out 4 premolars. And surprisingly, a lot of patients are, pretty nonchalant about it when you tell them, hey, I think I might have to take out teeth. But there are obviously patients who get a little bit freaked out by that. They have a lot of questions in their mind. And one common question they tend to ask is, okay, if you take out 4 teeth, am I going to be left with spaces? How is that going to work? And it's obviously we're not going to just take out 4 teeth and leave them as is and not close the spaces up. So we always tell the patients, no, you're not going to have any more space left. We're going to close all the teeth or all the spaces up. We're using that space in order to bring back these front teeth so that you have a more stable bite, your teeth are not as proclined, and also to help close this open bite as well. So this is mid-treatment. You can see she only has 4 premolars now rather than 8. And you can see here we have spacing from that extraction site that we made. So it gave us enough space to be able to retract these front teeth. So she no longer has the super flared proclined incisors anymore. You can see her smile's looking really nice. It's following the curvature of her lower lip, which we call a consonant smile arc, and something that we strive to achieve in every case. So this was how she finished. Patient was really, really happy. She's got a really nice smile, consonant smile arc. Her midlines are on or coincident. Her teeth are no longer flared, as you can see from this final ceph. And everything finished up really nicely. So We don't want to take out teeth if we don't have to, but in certain cases, that's actually the best option for the patient, and it can give really nice results if done properly. Lastly, this is a surgical case that I inherited in residency. This patient had a skeletal open bite, meaning it wasn't caused by a tongue habit or a thumb sucking habit or anything like that. It was actually a skeletal discrepancy that he had. You can see here on his ceph, he's once again got a really big mandible. I don't have the ceph numbers to show me exactly, but one way to tell if it's a skeletal or a dental problem is that you look at the teeth in relation to where they are with the upper lip. If it's a dental problem, the teeth will kind of be covered behind this upper lip, whereas if it's a skeletal problem, the teeth and lip are in the right spots where they should be. It's just that the whole maxilla or the upper jaw is positioned incorrectly. So this patient had an open bite here. You can also see he's got a posterior cross bite here. His lower jaw is too big compared to his upper jaw. So it was something that we didn't want to tackle non-surgically. And thankfully the patient was okay with going through surgery and his insurance covered it. So it worked out really well. So this is a pre-surgical snapshot. We often have to warn patients before sending them in for surgery that oftentimes their bite is going to look a little bit worse before surgery because we are purposely trying to kind of worsen things, make things as bad as they are going to get before we're able to fix them surgically. So here we kind of have made his open bite a little bit worse. He has these two planes of occlusion here, which are very defined. Obviously, he's still got that posterior crossbite that we're going to be fixing surgically. And these gnarly looking hooks here are just surgical hooks. They actually don't hurt the patient at all. They just look pretty gnarly, but these are hooks that the surgeons actually use during surgery to grab a hold of the segments and move them. They might also tie like a splint or something to them post-surgery. So this was actually how he finished up. And if you look at the before and after, you can see he's got a really nice overbite now, no longer has that open bite. He doesn't have that posterior crossbite anymore, although he does look a little bit tight here still, but that's one of the least stable things of surgery is actually making the maxilla wider. So you do have to expect that you might lose a little bit of expansion that you get, and you have to kind of overcorrect for that. But overall, the patient was really, really ecstatic. He loves his new smile. His teeth are straight. He can bite into a sandwich now, and he said this really transformed his life. And so, and it's interesting to see here in the pan and the ceph, you can see the actual screws that the surgeons place. These are to kind of like stabilize the segments together. They'll actually cut the jaws in certain areas, move them where they need to be, and then stabilize them with these screws. And patient doesn't feel them once they're in there, but every time they take an x-ray, you're going to see these pretty bright screws here, which can take some people, it can kind of surprise them a little bit, but we're pretty used to seeing these by now. So typical clinical tasks of an orthodontic resident. Obviously, I haven't started working yet, so I can really only speak about what residency life was like. There was a lot of diagnosing and treatment planning involved. Arguably, this is the most important step in any process of, beginning treatment for a patient. The better that you diagnose and the better that your treatment plan is, the smoother and easier and faster your treatment's going to be. So it's really important to set really good habits in the beginning, make sure to be really thorough, and a really big component of that is making sure you do the best for the patient's health, but also taking into consideration why they're there to see you and their chief complaint and what they're trying to address. Sometimes they come into your office and you see all these things that you would be able to fix, as an orthodontist, you're naturally drawn to see certain problems and things, but they might come to you to not even address any of those things and be like, well, I just want to fix this one tooth, or I want to do this with my smile. And if you don't address that one problem that they came to see you, they're not going to be happy. It's not a good practice builder, and there's going to be a lot of miscommunication between you and the patient. So always, always ask your patients why they're there to see you and what their goals are, and not be blinded just by your own goals. The consult is another really important aspect of being a healthcare provider. It's the chance for you to present to them all the different options and tell them that you've done your homework, and you are going to be able to give them the best treatment that you can for them. This is a chance for you to explain your options, but also for them to ask you questions and to kind of talk with the patient before you get started. The better that your informed consent is, it kind of covers your butt in the end. If anything, happens during treatment that the patient's unhappy with, if you discuss that with them before starting and you had an informed consent and they signed it all, then you're able to kind of explain to them that we talked about this and, this was what was to be expected. And patients do forget that as they go through. Obviously, they're not orthodontists, so, it's a lot of information thrown at them at the consult. So it's really important for you to document everything before you get started. We do a lot of initial bonding. That's, the first appointment that actually something gets cemented in the patient's mouth, whether that's an appliance or traditional braces or little attachments that we now use for Invisalign trays. We see a lot of SOS appointments. The less SOSs you have that day, the better of a day it is. These are, appointments that they come in for that wasn't scheduled because they broke an appliance or broke a bracket or their wire is really pokey and bothering them. So these actually get added on the day of. We see patients for reties, which is the monthly checkups that we have for each patient, just to make sure that their treatment is progressing smoothly and there's no negative things that are happening that you're not able to catch. Reties usually, vary between 4 to 8 weeks. I think out in the real world, it's more realistic to see patients every 6 to 8 weeks, whereas in residency, you want maximum resident learning. So we see them every 4 weeks to just be able to see what's going on. And then the most exciting day for patients is debond day. These are actually pretty long appointments. They can be 2 to 3 hours. We're taking off all the brackets, all the glue, taking x-rays, photos, taking impressions for retainers, smoothing all the edges out. And it's actually, it wasn't one of my favorite things in the beginning, but it quickly became one of my favorite appointments near the end of residency, just because I saw how excited and happy my patients were. And I was able to kind of utilize my artistic creative side when I was reshaping the teeth and making, the smile, giving them the nice finishing touches. So in the real world, in residency, we don't have assistants. So we are doing all of these appointments ourselves, doing all the hands-on work. In the real world, once you graduate and you start working, you're actually going to be training your assistants to do all this work. So it's really important that you have a good foundation of how to do these, because you'll be teaching these skills to assistants down the line. But once you are working, you're kind of the director, the pilot of telling the assistants what to do and what you expect. So you're not actually doing a lot of this hands-on work, but it's still really important that you learn how to do these things so that you can either train them very well, or if something goes wrong, you're always there to be able to troubleshoot and help them out. So some challenges and obstacles that you might face as an orthodontist: troubleshooting problems that may arise during treatment. No matter how well you diagnose and you treatment plan, things are going to come up. Every patient is different. Some patients may be terrible and never brush their teeth, or they break several brackets, or they never wear their rubber bands, and things are just not gonna go the way that you expect them to go or the way that you want them to go. So every appointment at a retie, you have to have in mind, you know, plan B, plan C, ways that you're going to troubleshoot these problems. That's the one good thing about ortho, is that, you know, you have a bit of a longer time span to be able to troubleshoot things, whereas as a general dentist or, you know, an endodontist, doing a root canal or an extraction, there's a lot of things that could go wrong on the spot. Whereas ortho, it takes a little bit of time for you to start seeing problems that may start to arise. But it is still important for you to catch these problems early on and make sure that you're steering them back on the right direction, because in the end, it could affect their health and their dental health and periodontal health and things like that. Another challenge might be being mindful of your patient's concerns while delivering quality care. As an orthodontist or a dental provider, you can kind of get so honed in on what you're doing and ways to make your treatment easier for them. But, you know, in the back of the patient's mind, they always have a certain goal that they're trying to achieve. And, you know, a lot of patients that I've seen have a specific event like a graduation or a wedding or something big coming up that they really want to have their braces done before. And you have to make sure that you're kind of helping them get to their goals and needs too. So you can't be too concerned just about what you're trying to achieve. Another thing that you might face, like Dr. Lee-Orthodontist touched on, is managing your staff once you're out in the real world. You know, if an assistant calls in sick and there's no backup, and you're going to have to figure out, okay, well, who's going to help me that day? And are you going to be the one to run around and kind of, you know, be that assistant and provider at the same time? Training assistants, training staff can be a really challenging thing as well. I haven't really had that experience quite yet, so it's something that I am a little bit nervous about, but it's definitely something that I am hopefully going to learn how to do quickly and hopefully enjoy doing. So I'm excited about that part. Another challenge or obstacle could be staying on schedule. You know, unavoidable things happen or unpredictable things happen, and you have a very set, tight schedule in a day. And if one patient ends up running overtime because of something you didn't predict, it could throw your whole schedule off. So you have to make sure you're managing time very well and being quick on your feet and just making sure that you're staying on top of schedule and things like that. And any healthcare provider is probably going to admit that there's always going to be difficult patients and patients who complain. You know, you're human too, and obviously you want to be an empathetic provider and do the best you can. But, you know, things are going to happen that are out of your control, and patients are going to kind of, you know, see you as a reason for that to happen. And, you know, they can be a little bit harsh sometimes and complain, and you have to make sure that you stay empathetic. And, you know, as a provider, you have to keep your cool and always listen to the patient no matter what they're saying and things like that. So I think everyone is going to experience that one time or another, and it's just another life skill that you have to learn how to manage. It's definitely something that I'm still working on, and probably something that I'll be continuing to work on as I start working in the real world too. So keep you guys updated on that and let you know how it goes once I start working. So if you're interested in dental school, there's a lot of things I could talk about, you know, how to apply and things that you could do to help, you know, boost your application. And I think Dr. Lee-Orthodontist talked a lot about this as well. But if I could kind of boil everything down into 3 simple things, I would say, 1, explore your passions and make sure this is definitely something that you're interested in and want to devote your time to. I would say gain as much shadowing experience as you can. The fact that you guys are here today to listen to this on a weekend is pretty amazing. And the more exposure that you get to it and realize that you really want to pursue this, the better. Make sure you find a mentor. I think in our day and age now with Instagram and so many doctors on there, it's really easy to find a mentor and find somebody to reach out to. So like Dr. Limbarakis said, I'm always available if you ever have a question or want a mentor to talk to about the application process. I'd love to help. If you have the time, or if you are interested in working as a dental assistant, that might be another thing to see if this is really something you're passionate about. I had a few friends and colleagues who worked as dental assistants and orthodontic assistants through dental school and residency, and it actually helped tremendously in their clinical skills. They were probably like light years ahead of people who hadn't had that hands-on experience. So, if it's something that you're willing to do, it's obviously a time commitment, but if it's something that you are able to do, I think that's great. Dental school is a long commitment, and it's a hard commitment, and it's a grueling 4 years, I'm not gonna lie. But if you are passionate about it and this is something you want to do, that'll help you kind of get through it and kind of see the light at the end of the tunnel. So definitely explore your passions before you kind of jump into it. The second thing is diversify your resume. Be a well-rounded candidate. Obviously good grades are really important, but it's not the end all be all, and it's not the only thing that matters. I know for me, like going into college was a huge shock, like a culture shock, and I didn't make good grades off the bat, and it was a learning process, and I had to figure out what I was doing. And I was so scared and worried that I wasn't going to get into dental school. And at the end of the day, I realized these people realize you're human, and it's okay to make mistakes. And as long as you're trying, and for me, when I was applying to dental school, they saw like the upward trend that I had. I didn't make the good grades that I wanted to like freshman, sophomore year, but junior, senior year, I kind of got my stuff together and figured out how to best study and utilize my time. And they saw that upward trend, and I was able to explain to them, what I learned and how I learned to study, and they really appreciated the honesty. So just make sure that you try your hardest, and if anything, try to improve and try to get better. Another thing is, like I said, be a well-rounded candidate. Don't just focus on grades and academics. Make sure you have passions and hobbies outside of school. Maybe volunteer if that's something you're really interested in, or play an instrument that you've loved since you were a child, or a sport that you've played forever. Just something that you can talk about at your interviews and on your personal statements that make you unique and stand out, and not just blend in with everybody else. I think that is a huge advantage to you. And thirdly, I just say perseverance. Like I mentioned, college, dental school, residency, it's a long road, and there are a lot of times that you're probably going to want to question yourself and, why did I do this? Why did I get here? But at the end of the day, it's worth it if it's something that you really want to do. So just keep going with it. You got this. It's okay if you don't get into dental school right away. Like I mentioned, I did a master's program for a year to help kind of boost my credentials and get to know the people at the dental school on the admission staff, and kind of give myself a little bit of a boost to try to get into dental school, because applying to dental school is not cheap. And I wanted my best shot at it. So if your route is non-traditional and you don't get in straight after college, that's okay. Just make sure that you make the most of your time during that gap year that you have, and do something that's going to help you be a better candidate, whether that's doing a master's program or working, or even traveling the world and, gaining insight about, learning in the world that way. Just as long as it's something that you can talk about, I think is great. So try not to get discouraged. And, if you guys ever have any questions or concerns, or just want a mentor or someone to talk to, I'm always available. You can reach me through Instagram or my email. I'm like Dr. Limbarakis, I'm on my phone way too much and I will see everything. So feel free to reach out. And thanks so much for letting me talk today. If you guys have any questions, I would love to answer them. But if not, that's all I had for today.
Thank you so much for speaking at our webinar, and that was so interesting.
Oh, I'm so glad.
The presentation was very creative. I really like the slides.
Oh, thank you. It's Canva. If you guys ever want to create a presentation, canva.com is really cool. So
yeah, so if you guys have any questions, you're free to ask them. If not, you're free to go as well. That was our last speaker. So if you don't have any questions, you can go ahead and leave.
let me see. Okay. Yeah, I was just checking the chat to make sure there were no questions there, but thank you guys so much for hanging out with us today. I know it's a Saturday, so we probably had more interesting things to do, but I really appreciate you guys taking the time to listen to us today. All right, well, I think I will stop sharing now.